Good afternoon, everyone. Thank you so much for joining us today for Creatio's webinar. Today is a very special occasion as we're joined by a valued partner as we discuss our topic, which is 5 ways to keep your employees healthy and safe with the help of low code during and post COVID-19. I'm going to be joined today by one of my colleagues and valued partners as we talk about this in some greater detail. My name is Creatio, and I look forward to joining my colleagues and our valued partner as we talk about this, and we hope to make this an interactive discussion. We will welcome you to post your questions in the Q&A section throughout this webinar, and following the discussion, we'll provide all registered participants with a recording of the webinar, and we'll answer any of your unanswered questions offline. We have established an agenda for today. First, we'll be giving a brief introduction of our speakers and the companies that are participating on this webinar, followed by a discussion about the impacts of COVID-19 on the digital health market. We'll talk about how to make health and safety a priority during the return to work process, followed by the experts discussion and Dynametics live video. Then we'll talk about why low code and why Creatio's offering can help support these companies. And then, like I said, we'll have a Q&A discussion because we hope to make this a very interactive webinar today. We invite you to post your questions in the chat section, and we hope to reach all of the live questions today here. And for any unanswered questions, we will respond to you offline today. So I'm going to move forward and introduce our first speaker. So Ross, why don't you give yourself a brief introduction?
Hi, thanks. Yeah, my name is Ross Howarth, and as you can see from the mini bio, I've been working really in the healthcare sector for 15, nearly 16 years, predominantly focused on corporate health and delivering remote medical services to a number of corporates in predominantly industrial sectors. Initially actually delivering sort of primary, pre-hospital and occupational healthcare into the oil and gas industry. So delivering healthcare services on rigs and remote sites, basically all around the world. Initially in the North Sea, so the UK and Scandinavian sectors, Norway, through to places like Kazakhstan, Middle East, North Africa and West Africa. So experience of delivering medical and healthcare services to corporates in pretty challenging locations. So as you can imagine, we had to really look at how we use technology to deliver those services into those remote locations. So we were using various telemedicine solutions, digital health and other sort of digital CPD, so continual professional development tools to our healthcare practitioners, as well as obviously, ERP sort of patient management systems. For the last 8 years, I've been running my own business, providing blended advisory services to SMEs and startups. So a lot more health tech businesses really in my portfolio, as well as still a number of occupational health and medical services businesses. So this is an area of passion of mine, as you can imagine.
Excellent, thank you, Ross.
Hi everyone, I'm Aisha, I'm the next speaker. I'm a product manager at Mitra Innovation. We're a global integration partner with Creatio. My experience primarily has been across digital healthcare services with specific attention on consumers and patient experience. We've also been working with multiple health chains, organizations across the globe. With UK, in Australia, we've seen different policy changes in terms of employee well-being, employee assistance programs that all tie into patient engagement and overall well-being and care across all aspects of work and home life as well. I'm also part of the Mitra Innovation product innovation team. So there's a lot of attention given towards, the change in the current pandemic and how we're responding towards it as well. I'll also move on to a quick introduction about Mitra. So Mitra, as I mentioned, is a global integration partner with Creatio. We help multiple ISVs, enterprises and health tech opportunities, improving multiple business processes, ensuring that we have better decision making with data, and also focusing on cloud enablement and machine learning as well. In addition, at the very core of Mitra is that we are passionate about innovation. So it's all, of course, in terms of evolving with times, ensuring that it's not just the pandemic being a challenging time, but also the opportunities in ensuring continued services across all employees and our customers. So we have multiple partners across the globe, and we also form the bedrock of software engineering discipline, including continuous improvement with strong skills in business process management and low code, no code, which we will hear about later on as well.
Thank you so much, Aisha. We're so happy to have you on today. So thank you for joining us.
Hi, I'm Eric Hale. I'm Director of Sales Enablement at Creatio. My role here is to align our marketing, sales, and operations strategy. Within my role, I spend a lot of time focused on how we can align our market segment to the healthcare industry. I've also got an extensive background in engagement and relationship management software sales in the healthcare industry, specifically with the insurance or payer industry here in the US. Really spent a lot of time working with how we can help individuals, create better engagements with their customers, throughout the globe. And just to give you a little background on Creatio ourselves, we are a global organization headquartered here in Boston, Massachusetts, where I sit, but we have 5 offices around the globe, roughly 650 employees. Interesting fact about that number is that nearly half of our employees are focused on the research and development of our platform. So we are definitely a technology-driven company. And we also have a very robust partner network. So we work with a lot of enterprise-grade partners, such as Mitra. We have over 700 partners within our program. We're spread out over 110 countries. We've also been highly recognized by key industry analysts at Gartner and Forrester, and we'll be talking about that a little later within the webinar. So on to our subject today, and I don't think this comes as a surprise for anybody, but the recent COVID-19 pandemic has really led to a substantial rise in digital healthcare. So we all know that social distancing is the new norm. Doctors and healthcare professionals are utilizing telemedicine where they can to treat patients remotely, and all of this is to avoid the spread of the virus. A couple of interesting facts: the global digital healthcare market is predicted to reach a valuation of over $3 billion by 2025. So this is a compound average growth of 26% between 2019 and 2025. So we can really see that this has had an impact on the digital health market. So digital transformation of the healthcare industry has the potential to drastically improve the ability for doctors, hospitals, and other types of organizations to treat patients and also provide better healthcare outcomes for them. But they do face a number of challenges that they have to think about as they go through this transformation process. They have to be prepared for security breaches, which can be extremely costly. They need to add additional technologies to keep up with changing consumer expectations without violating compliance standards like HIPAA. And with patient data coming in from multiple sources across health systems, it's hard to maintain those more personalized care options that everybody strives for. And it's also hard to maintain patient confidential information while they're sharing patient records across the system. Third, the thing that I wanted to point out on this slide is that we also have to think about it from a consumer expectation perspective. And just as in our normal lives, consumers of healthcare also have expectations, and providers need to keep up, or they stand to lose patients to alternative solutions. The same way the crisis has affected the healthcare industry, it's also affected the way our employees work and seek medical care as well. So, we see an increase from 30% of workers working from home to 48% post-COVID. So you can see that there's a more of a take to people working from home just to keep the spread of the virus down. We also see, an uptick in workers seeking telehealth options. That's up 35% over the past year. And again, this is starting to lead towards, more trends. Is this, due to the COVID outbreak, or is this going to be the new norm for us? Is really the question that we're all, looking at. And we can see that it might change the way that we seek healthcare going forward, because it's not affecting the overall quality of care. 74% of telehealth users reported high satisfaction in remote care. So if we can get that same level of care, do we see that this is a trend that's going to continue post-COVID? And you can see that this is having a huge impact on the market. Analysts anticipate that $250 billion of current spend in the US could be potentially virtualized. And there's been a 50 to 175% increase in digital healthcare transactions just since the onset of COVID. And this is, some of the key areas that are driving the digital healthcare revolution. We have on-demand virtual urgent care. So, you come across an emergency, you're able to connect remotely, have certain things addressed, in a timely manner. We have virtual and near virtual office visits. Again, being able to pre-diagnose, also have health risk assessments remotely. All of this is, leading to the fact that we, want to stay away from having to go into a doctor's office to have some of this initial screening done. But beyond, those, initial consultations, we're also starting to look at ongoing support virtually as well, right? So virtual home health services, how do we check in on the elderly, while they're, unable to make it to facilities. And also tech-enabled medication administration. This is another thing that we're starting to see a lot of organizations, manage, through technology versus, again, having a more hands-on approach. So in order to realize the full potential of digital care, there needs to be coordination across the entire healthcare ecosystem. And we look at an ecosystem in a couple of different manners. The first box that you're looking at, insurance providers or payers, need to focus on value-based care options to incentivize digital healthcare. They need to build virtual health into their product offerings. And this will encourage that type of behavior from their subscribers. The middle portion is really surrounding health systems and healthcare providers. They need to build the capabilities to support digital healthcare options, and also measure the outcomes to ensure that that level of care they're providing to their patients is consistent. So we're seeing that they're doing a great job on that from that last slide. We see great potential there. And then finally, the third part of this ecosystem really is about technology providers. And technology providers really need to be focused on how the market will evolve and continuously develop new potential options that they can bring to market and meet the demands of the healthcare systems that they're supporting.
Excellent. Thank you so much, Eric. So let's open up this this session to be interactive, as mentioned before, and do a quick poll with our audience today. So our first question is, what shifts are you experiencing in your workplace in the current economic climate? And we have some options here. So as you all quickly take a look at these options and select what you feel is most appropriate for what you're experiencing, how about we take a question from the audience, Eric?
Yeah, sounds good, Greg.
Great. So how has the pandemic shaped the future of work? What implications and actions should people manage to adapt, or should managers adapt as COVID-19 drives shifts in the future of work?
Yeah, that's a great question. I think we have a slide coming up on that momentarily, but obviously, it's affected the way we're all returning to work, right? We're starting to see that here in Boston, Gray, right? Like everybody's starting to get back to the office. So, there's a lot of things that need to be considered. How much contact you have with, the outside world, how much, how prolonged is that interaction? What do we need to do in terms of setting up our office space to keep our employees happy and healthy? And then, finally, what is that screening process going to be to look like as workers slowly come back to the office? Will we have to screen those employees? Is it daily? Is there ongoing reports on the state of their health? There's a lot to consider. So I think it has really reshaped the way we're going to be working, and then also considering the fact that we've all had to work at home. Does that continue? Like, is this a viable option going forward to allow our employees to work more from home so that way they stay healthy? So I think absolutely it has impacted the way we're going to work going forward, at least in the near term. And we will see how companies adapt to these changes going forward.
Excellent. Thank you so much, Eric. So let's take a look at these results and we'll continue moving forward. Increase in remote working. So I think everyone has been experiencing this right now. Well, these are definitely all things that we're seeing in the current climate. This is definitely an important one. So we'll continue moving forward with the discussion and address how organizations can focus on this. Let's take another question. Well, maybe before we keep moving on, how about?
Sure.
So how can organizations promote employee well-being? I know we talked about doing some of these health checks before using a low-code system, Eric, but maybe we can elaborate on some other ways.
Yeah, and open up to the other speakers here as well. I know I've been talking for a little bit, but maybe Ashok or Ross or Aisha want to chime in on that answer as well. I don't want to steal everybody's thunder here.
Yeah, I mean, I'm happy to pick up on that and start to answer it, because I mean that partially, I guess, is one of the things that we'll no doubt cover in the discussion topic. But I think one of the things that I'm seeing across through my kind of the lens of my client portfolio, who are servicing a lot of corporate employers in this space, is that a lot of employers actually now are in a bit of a state of paralysis because they just don't know what to do, and are looking to various sort of regulatory bodies in terms of advice around best practice, in terms of both what should they be doing in terms of this extended duty of care for people working at home, and providing them with a different way to access the sort of healthcare support that they may have already had in place, or put new healthcare options in place, and through to what's their sort of obligations. What is their health and safety responsibility from a liability perspective, because what has clearly happened here is that health has now become a safety issue. Around COVID, they now have a responsibility to ensure that they are not allowing or ignoring the risk associated with transmission of a virus in the workplace. And there is a lot of conflicting advice out there from various bodies, particularly here in the UK, a lot of contradictory advice coming out from the government, coming out from guidance bodies like the Faculty of Occupational Health, like the Health and Safety Executive, the HR body, CIPD, are all contradicting each other in terms of what employers should do. So it is a really challenging time for HR directors and health and safety directors to work out what they need to do. So we'll elaborate a little bit on the next section, but I think it's a really good point. I mean, it's very, very challenging at the minute from an employer's perspective.
Yes, thank you so much, Ross. So let's continue moving forward so that we can address some of these items.
Yeah, absolutely. And I think that we just went into depth on this, so I won't spend a lot of time. But we need to think about how employers are going to manage the return to work process, right? So if we look at it from the perspective of risk levels, right? We just talked about that in the last question. This is kind of a busy slide, but it's kind of what the environment we're working in here, right? So there's going to be levels of risk based on what type of organization you are, and as you can see, we have this diagram that kind of elaborates on again, what are the unique contacts that you're going to have in a typical workday, and how closely and how long you're going to be interacting within your roles. So you have maybe there's some isolated work where it could be mail delivery, not coming in contact a lot but being exposed. So your risk is going to be a little lower than, let's say, someone working in a barbershop, right? So barbershop is a close, intimate engagement with your clients. So you don't really have a chance to distance yourself and keep yourself apart. So one, you got to analyze the level of risk or your exposure that you're going to have, and then you're going to have to make your plan based on these different risk factors. So obviously, some people are going to be more exposed than others. So what steps are they going to need to take? And again, we just talked about this. Could be once you've identified the risk factor of the returning employees, what do you need to do to be safe? Well, if it is a high touch, type of environment, can they work remotely where possible? If you think about a bank with a branch location, is it possible that you can support your customers remotely or virtually versus having them come in? Is it going to be testing? And again, is that testing on a daily basis, ongoing basis? How much do you have to test your employees for the virus? Mental health is always another thing that we have to take a look at. People are really stressed out about, I have to hop on the subway to get to work. I have to, come in contact and ride the elevator to the top. This can have a toll on people's mental health as well. System assessment, right? How are we putting programs in place to say, how are you feeling today? Have you had any of these symptoms? And how do we track that and monitor that as employers? And then finally, the ongoing training and education, right? How do we keep everybody safe? What are the steps that we need to take as an organization to make sure that we're all healthy within our environments? And then 6, this is another big consideration is childcare. Again, a lot of childcare facilities, I know here in the U.S. and Creatio, you were kind of a victim of this as well.
Absolutely.
Yeah, shut down. So what do you do in that situation as well? So these are all considerations that employers have to take and and measure and come up with a plan. So I'm sure that our panel here will discuss this in more detail. So I think what we'll do at this point is turn it over for another quick poll, and then have an open discussion here.
Great, thank you so much, Eric. So again, we want to make sure that we're hearing your voice from the audience. So our next question is, what digital health solutions have been adopted to monitor employees' productivity and well-being in your company? So if you could just take a moment to select the response that best fits your situation here. And Eric, Ross, and Aisha, we'll take another question from the audience while we wait to pull this poll. So how does technology lend itself to combating challenges in the well-being space of employees?
Good, great.
I'm happy to take.
Yeah, go ahead, Ashok. I was waiting for your expertise anyway.
Yeah, sure. I think the well-being is becoming a bigger challenge, which we will talk in the next section, as the organizations have to deal with remote working, which we saw in the previous poll. As the organizations move, especially from a confined space, I think there was another question around that. How do you manage in a distributed work environment? There are various technologies that are coming into place. There's one we will demo in the second half of this webinar, but there are various products coming in, whether it's a way to analyze your symptoms, ability to order your test kits remotely, ability to share your emotions, your stress level, or your preference to work from remote location versus going into the office, or you didn't go into the work environment for an extended period of time, but you continue to work from remote location. There are a lot of challenges the analysts are looking at, the psychiatrists and the Oxfords and the Cambridge of the world are analyzing it, but we do see quite a lot of technology coming into the market. The problem is, how do you make it really practical? I think that's one area we from Mitra Innovation doing a lot of research, but we do see there's a lot of technology coming out there that'll help all of us. Hopefully we'll have the full answer.
Yes, so let's take a look at the results from the poll. Thank you so much for answering this question. And we've seen the majority of our audience has said remote work tools. Definitely something that has been important to adopt and monitor, for employee well-being and productivity. Thank you so much for your participation in this poll, everyone. Let's continue moving forward.
So I think the next session is around a quick interview. So first of all, a quick introduction. I am Ashok Supaya, co-founder and the CEO of Mitra Innovation, the Creatio partner who's presenting this webinar. I'm actually excited to be in this webinar for two reasons. One, to share some of our experience and knowledge, but two, I get to interview Ross, who I got to know in the last year or so. So Ross, you introduced yourself as an expert and with a lot of experience on the healthcare and also in the corporate environment as well. The last two polls are very interesting. I think majority, like the McKinsey's and others, are saying more remote work is wow, that people see it, but there are a lot of issues, well-being, etc. So the first question I wanted to ask you is around the pandemic itself. What impact do you think that the pandemic has had on the future of workplace, whether it's health and safety or well-being, whatever it might be?
So I think, Ashok, I mean, it's had a huge impact, actually, a huge impact. And I think it's a permanent impact as well. This isn't a temporary impact. I think this shift, it's a paradigm shift in the way that both employees are going to work. As you can see, I think from the background, we're all working from home in sort of strange locations within our houses. I'm in my son's study, actually. That's why I've got a Kenyan flag in the background. That's where I'm from originally, so patriotic, so sort of you have to excuse the backdrop. But I think we've all been familiar, for those of us that are working from home, will have seen into people, colleagues' bedrooms, kitchens, seen their pets and their children. There's a big paradigm shift in the way that we've worked. I've seen people that I've only ever seen in suits and ties, now seen them in their dressing gowns on Zoom calls and Zoom meetings. So, apart from that there's a paradigm shift in terms of the sort of way in which employers and employees are working in teams just now. What has actually happened, though, from a health and safety perspective, I think, is all it really has done is acted as a catalyst to rapidly accelerate what was already happening, that we were seeing in some sectors, where regulators and industry bodies were already starting to take a real interest in actually enforcing employers to take responsibility around protecting the health and well-being of their employees. As most people will have seen, been very topical in the last couple of years, the growing attention around mental health at work, mental well-being, stress at work. A lot of solutions have been put in place from a healthcare and an occupational health perspective. What I've seen really happening recently in terms of the big emphasis in terms of what people who have been reluctant to take health seriously in the workplace is that they are now seeing health as a safety critical issue rather than health as a nice thing to have, that I'm a caring employer, to now this is something that I can't ignore. It's not a luxury. It's not something that I'm a kind employer. It's absolutely mandatory that I protect my employees from the health risk that they're exposed to in coming to work. And this is particularly for industries where people need to physically be at work. So construction sectors, oil and gas, logistics. You've seen some of it on that slide Eric produced. These other sort of close contact where people have to physically be at work. It's a big challenge for them, because they know that they now cannot actively expose employees to come into an environment where they might end up with COVID and be hospitalized. There's a lot of evidence, particularly in middle-aged men, which in some of these industrial sectors, it's are dominated by a male workforce in their 50s. It's a big issue in oil and gas, and they are at particularly high risk if they do contract COVID, that they will end up with severe respiratory issues. So there is a real risk profiling issue. We've lost you, Ashok. Your voice, I don't know if your mic has gone.
Oh, it went on to mute automatically. It doesn't like me talking. Just following on the same topic, focusing on the employers, the corporate side. And you mentioned we need to focus a bit more on the health side. What about the duty of care? What implication this lockdown and the post-lockdown will place on employers, especially on the duty of care within the health element?
Yes, I touched on that as part of this permanent change, and I alluded to it, I think, in that first poll question, is that there is a lot of confusion at the moment and ambiguity around what the duty of care of an employer actually is. And obviously there's no legislation or guidance already in place, so a lot of people are having to sort of make it up through consensus, typically in their own industry sectors. But what in the sectors that have already had to deal with is what I've seen sort of emerge in terms of the general view or consensus around health and safety directors and HR directors in particular, who I talk to on a regular basis, is that that they feel that it's their responsibility to protect employees coming into work from communicable diseases, not just COVID, but everything, including influenza. So it's become a real issue that they now have accepted that that's what they've got to do. How am I seeing that translate into what they're doing? What a lot of them are doing is there's two things really: is how do they make sure that the working environment is safe? So there's a big sort of sterilization, disinfecting programs that they're having to put in place to regularly clean and keep clean the working environment, whether that's a workshop environment, whether that's an oil rig, or even for those that have come back into the few that have had to come back into office environments. They've obviously had to put PPE wherever practical. The one thing that they haven't done, which it contradicts government support, is social distancing, because it's just not practical where people have to physically work together to lift things together. So they're ignoring the social distancing rules because they just have to be pragmatic. And what is really focusing the minds more of the clients that are in the non-industrial sectors is worry about public liability. So we've seen a couple, the class action lawsuits in the US. Well, actually, one of them, again, brought by employees against an employer. So there is a real fear that if they're not protecting employees, so there is a sort of a fear factor that's driving the duty of care. But we're seeing the public health in terms of the cruise line industry and the ski resorts industries now being sued by the members of the public because they weren't ensuring that the venue was safe and any employees aren't transmitting diseases, communicable diseases to the public. So it really is focusing the minds, but actually a lot of them are still very confused as to what they should be doing and what their legal responsibilities are. And I don't think we're going to see any clarity emerging for probably at least 12 months.
Yeah, I think you're right. And you mentioned duty of care on those industries, but even if you take the corporate workplace, the duty of care is now higher, irrespective of there's COVID or not. Even if somebody brings some other disease into the office and infect number of others and productivity is lost, it is a challenge. Now focusing more on the employee side, if you don't mind, we saw some poll results about how they see the new workplace. What should employers do to protect the employees, which you already answered to a certain extent, but more importantly, promote health, safety, and well-being, especially the well-being? We've seen few organizations, large corporates have to try that in the past, but they really haven't succeeded, isn't it? Do you see in the new world there is a better way employers could promote programs?
Yeah, so as I say, a few industries were already starting to do this, look at well-being strategies and access to mental health support for employees, as well as rapid access to physiotherapy type services for any musculoskeletal type issues in an occupational health. So we were seeing some responsibilities that were taking their sort of social, a duty of care and sort of corporate social responsibility seriously. But I think what's happened now is that in terms of employees' expectations have gone up because the people are now concerned. And again, Eric touched upon it. And again, I'm seeing in some of the office-based financial services sectors, people not wanting to come back to work because of concerns about coming in on public transport. Even if the workplace has been, decontaminated and disinfected, 5 times a day, it's still not enough to reassure them. So there is this sort of high-level anxiety. So there are workplace adjustments that are being made to allow people to permanently work from home where they can. So I think that's going to happen in terms of protecting employees. But because of those that are going to be working remotely, is going to be a huge number of the working population. So what employers are now going to have to do is make these services available digitally through teleconsultation, through digital triage, and we will start to see, and are already seeing, actually, I'm seeing a number of corporates implement a digital triage solution for physiotherapy services to be able to either go into a self-care pathway where they can carry out suitable exercises, or to go into a telehealth or video-based consultation with a physiotherapist. And I understand, I haven't seen it myself, that similar things are happening in terms of accessing psychiatrists, psychologists, and counselors for mental health.
Sure. You actually, I was going to ask you another question, which you briefly touched on, the type of technology. But if you think technology at a broad space, what role do you think technology could play to combat some of these challenges? and especially given you're sitting in various health tech boards, what are they doing, or what more do you think that tech can really help to prevent and help people to work in their preferred location and way of working?
I think, in my view, technology is absolutely fundamental. I don't believe that employers will be able to meet both their sort of moral, ethical obligations, let alone any sort of regulatory obligations that are going to be imposed on them without having to use and leverage technology. And the main reason for that, if you take screening, which is one of the most important things that any employer is going to have to do, they're going to have to implement a regular testing, and it has to go beyond COVID, a communicable disease testing program, to ensure that you're not actively infecting people whilst at work. The cost of that right now is incredibly expensive for employers to implement that. The cost of carrying out testing is expensive. And a lot of these companies are already struggling economically as a result of the downturn. So there is this dichotomy they have now. They've got this enhanced duty of care. They're aware now that they've gone from the sort of being unconsciously aware of the problem, their obligation, to being consciously aware. So they now can't ignore it. They have to deal with it, but they just don't know how to manage the cost impact. And the only way I believe that they can do that is leveraging technology and sort of using digital process automation to access some of these services and to allow employees to access the sort of healthcare support. So it's going to become mandatory, both from an economic reason and from just the remote nature of having to provide support to people working at distance from one another.
Brilliant. Thanks, Ross. I have actually one question from the audience, which I thought you could answer. What industry sectors will need to deploy digital health tech as a priority?
I think every sector. I mean, I think I kind of touched on that. I mean, I think whether you're a financial services sector with, and in fact, I actually have one client right now who's trying to get out of their lease permanently, where they had, over 100 people working in an expensive real estate in the middle of London, because they decided they're permanently going to go to a remote working environment. So even in the sort of white collar environments, you're going to see the need, to be able to provide the support digitally. And in the industrial sectors, you're going to need, a digitally enabled screening, a tracking process to sort of be able to assure both employees and the public that you're doing everything. You're going to need to evidence that you're doing it. And the only way you can do that realistically is through technology. And as I say, to keep the cost down, you're going to need technology.
Thank you, Ross. I wish we had more time. I think we can spend probably a couple of hours on these topics.
Oh, yes.
But thank you so much for your insights. I'm going to hand it over to Aisha, who will walk us through a product that that could help us in these challenges. So Aisha, over to you.
Brilliant. That was definitely very illuminating as well. In terms of sitting through the details, I just thought we could go through a very quick demo and also speak through some processes in terms of where we see technology has been taking through some main pathways in moving forward. Yeah. So I'm just going to share my screen, and so until that comes up, just going to run it through. At Mitra, we did go through a platform to run through innovation as well. So we thought of moving into health and well-being as a solution in terms of the pandemic creating an opportunity overall across all these different industries. Okay, so the pandemic really resets our work trends. Business and HR leaders are rethinking workforce, employee planning, management, performance, and even employee experience strategies. I know, Eric, at the beginning you mentioned that large number of organizations are moving into remote work, and that also was the response from the poll with the team today also. And in a recent Gartner analysis, it stated that 16% of employers are now using technologies more frequently. So whether that is having a quick pulse check, ensuring that there is engagement with this remote workforce and contingent workforces, we see these different trends coming up in the current space. So Dynamedics essentially was set up as a quick technology moving to health and well-being innovation. There are a few variations here because for patients, for frontline workers and workplaces, each of the nuances, whether it be on the different industries or the type of workforce, distributed workforce with maybe many contractors, each of these kind of take a different nuance in how it can be adapted to employment and emotional well-being as well. So the current crisis, has really pushed the bounds of how employers view this employee experience, and now it needs to get a little more personal. More personal factors take precedence. This includes an effective way to promote physical health and improve emotional well-being. So this goes beyond, occupational health and safety. It's about having an employee experience that reflects well-being and health and assurance. So something that we moved into in terms of the Dynamedic platform is how we can now move into adapting to this new mode of work, what we're considering the new norm. For many employers, this would essentially mean engagement, assessment, monitoring and supporting of employees, right? This safety, well-being and mental health of all employees has already seen quite a few revisions in terms of international policies in this post-COVID world. So the future ISO 45103, the occupational health and safety management guidelines has actually been revised already with the COVID-19 back to work processes. So companies, of course, will now need to ensure that they're actually capturing and managing, mitigating these health risks faced both by frontline workers and in the common workspace, like we are within, working with our laptops, working with the retail sector and so on. So Dynamedics essentially, we envisioned it as a quick technology that will have multiple modules that covers all the way from insurance coverage, employee assistance programs, a very specific COVID-19 pre-screening touch point. Ross mentioned, that there's actually health tech now coming up in terms of ensuring musculoskeletal issues, in terms of providing physio assessments for contractors who probably are more vulnerable and need access more immediately or urgently. And of course, mental health also has increasingly become an area of focus. So I'll very quickly move into some of the key elements in terms of the platform and how you can essentially move into the post-COVID-19 workspace. It really comes through in designing work by actually focusing on well-being, ensuring that employees can live and perform at their best. So the COVID-19 shift itself has actually ensured that, or forced us or accelerated us, all of us around the world, to actually put well-being front and center of the organization. And this goes well beyond just financial security, but touching into mental well-being. For example, the pandemic, it has created more hours to the working day. I think I hear it around from multiple conversations across when we speak to our customers and potential clients. They speak about employees having a lot of exhaustion and burnout. There's of course a lot of stress that many workers face. Together, I think even in some of the tips we spoke about, what happens when you're a parent or a caregiver. I have my nieces next door who are constantly getting homeschooled now, but a lot of the work is with the parent. So it's all a lot of levels of stress, and juggling that with this whole remote mode of work, new technologies, new tools, obviously means that there's quite a bit in terms of adaptive technology that needs to be in place. But of course, it needs to be employee experience that also garners engagement and provides just-in-time information to management so that we can actually move forward and make the right actions, even if it's as simple as creating the right employee assistance program, as simple as setting a touch point and engagement in terms of maybe some tips, sharing in terms of different branches in a retail store or different sites within a construction workspace to actually share how they are tackling day-to-day issues. Yeah. In terms of the good thing, I think, is Gartner recently had a quick poll in terms of the post-COVID-19 and current workspace across a few, across US and Europe. And even though employee stress and anxiety has been, increased in a general consensus, 60% actually expect to deal with this, maintaining employee resiliency. And that's a huge, I think a repeated message to all human reactions, right? We continue to be a very resilient community. So this actually moves into all these different frontline workspace and clinical pathways in terms of an end-to-end system. I'm very quickly actually going to try to show or bring up a quick demonstration. I might take just 2 minutes just to give you a quick gauge of what this looks like in terms of just a very small module out of all of this. So because most of the folks today have, joined in looking into the COVID-19 screening, I'm very quickly going to set that up very quickly. I'm just going to do a screen share very soon from my mobile because this is a mobile interface on which I am going to be executing this. Just bringing up my screen. Okay, so it's as simple now in terms of having a wellness check. This can be at any frequency, and this demonstration that I'm doing for the COVID-19, we actually have various different nuances for the different industries, different regions, different policies, and it's vastly different between a retail store or construction site. So this is very configurable, but the idea is that you have more regular touch points, and of course, considering GDPR compliance and personal data that we might be catching in. I'm just very quickly going to set up some of this information. So very quick and subtle nuances in terms of how I feel in terms of reporting. It might actually have different trends. It's actually been noted that there's a very high occurrence of employees reporting consistent levels of stress. So we actually have intelligent modules that analyze on a trend basis how you can essentially maintain the health and safety and well-being of organizations by ensuring that we get very point and directive insights in terms of exactly which employees need some sort of risk escalation or health assistance. So I'm just going to move forward in terms of some of these responses. You can essentially move into a checkpoint in terms of COVID-19 itself. There are multiple different modules here in terms of how you capture the well-being. I'm just going to continue some of the information here, put together some details of my my current status and whether I have any other symptoms. Also capture in whether there's been, movement through this through different countries and so on, because there can be a lot of industries where you do have to kind of still, or when you get back to work and as well as global travel. So I'm just going to set this through in terms of a check-in. So because I used a profile as an employee who had consistent levels of stress in my current profile, it actually prompts me also whether I would need access to a physiotherapist or mental coach, or just a simple conversation with your HR partner, so that there can be callbacks from the organization, seeking in for help and so on. So this is a very quick idea in terms of how employees could possibly, put together the details. This goes through in terms of a supervisor now getting the list of all different employees and how they have kind of responded, and automated check-in based on the COVID-19 symptoms, whether they are actually cleared in for work, that is, that they're approved for work, or they actually need some assistance in terms of staying at home. We can also have additional touch points in terms of any other symptoms, put in more notes in terms of how we've observed employee behavior as well. So I'm very quickly going to go on to other details. Just going to stop mirroring and quickly take you through some of the management insights. So from an HR perspective, you can have multiple insights in terms of the number of employees at risk are maintained at, like which exact locations, how many folks have essentially required assistance in terms of additional mental well-being, or health services as well. So that kind of concludes a very short presentation on one of the modules that we have actually run through. I'll pass that on very quickly over to the team now.
Thank you so much, Aisha. This was a really, really helpful discussion for us, and a great demonstration. So we're appreciative for you providing this. Well, we're actually running up on time, so we want to just mention to you that we will try to answer any of your questions that you have that have not been answered in the live discussion today offline. I want to say thank you to our speakers who have joined us for the discussion today. So thank you so much, Ross, Aisha, Akash, and Eric. If you have any final words for the audience before we finish up today, please take feel free.
Yeah, this is Eric. I just wanted to thank everybody again, Mitra team, Ross, everybody. The demonstration was phenomenal. I think that really spoke to how technology can address these challenges. So I just wanted to thank you guys for joining, and I'm sure that the audience found it very beneficial.